chose to speak about a topic that is near and dear to my heart. I've been working with kangaroo care for almost 30 years now. Kangaroo care itself has been around a whole lot longer than that. But we're going to talk about the benefits of kangaroo care, why we need it, what the biology of it is, and how it works for moms and babies. And I put a little acronym together for it, skin to skin. Okay, looks like we're going to do this by hand. So skin to skin infant care, a little bit different because we don't have the pouches, but it started being called kangaroo care because it was putting the baby in the appropriate environment for optimal growth and nutrition. We don't have to have pouches because we don't have short arms and we don't hop through the forest. So we can hold our babies this way, and that's the optimal environment for them. It is mainly done by the mother, but we do encourage it to be done by anyone with a pair of arms who wants to warm up this baby and bond with it. It says it's best when started at birth because there are actually unique traits and unique benefits that are gained within the first hour or two of birth. They call it the golden hour, but the research that I did for my master's, we actually looked at remediation of breastfeeding failure with kangaroo care. We had some pretty good successes with that outside of that golden hour. There are lots and lots of benefits for both the baby and the family. There are some interesting benefits for the mother, and we're going to talk about those. So skin to skin, what the baby experiences, first of all, it's the chest rise and fall of the mother. Okay? The feel of the skin plus the feel of the warmth, both of those things. And then the smell of mom and mom's breast, this is key for teaching the baby where food is, where home is, and for orienting the baby to his or her environment. The sounds of voices, breathing, and heartbeat, those are all, should be pretty familiar to the baby from prenatal. However, we see something really interesting with the dads who do this. We call it the neck nestle. The babies actually scooch up high and they nestle right up here. We think it's because they like hearing the vibrations of the deep voices on the males. They don't do that with the moms. They scooch down with the moms, they scooch up with the dads. So the experience is actually very different for males and females. Okay. The safety position, yes.
Is that assuming the father is also bare-chested?
Yeah.
Oh, okay.
It's always skin to skin, and
Okay.
it could be the father, it could be the grandma or the grandpa. We actually had a midwife do it with a baby who'd been abandoned. We'll talk about that a little bit later. The safety position is 30 degrees or so back, skin to skin, and the back is covered. Generally, the head is covered as well because babies lose heat at 4 times the rate of adults, right? You learned that in class. So we need to make sure that they're not losing more heat than they're gaining. All right, who does it and how? Mom, dad, grandma, sister, or brother. Is it diaper only, except for the hat? A couple of these babies don't have hats on, but that's because they've graduated past that. There's a light blanket or shirt over the top. Sometimes I'll put the dads or the males in a patient gown, and everyone gets a hoot out of that one to see that. Okay. Carrying in a sling is another way to do it. This isn't precisely skin to skin with this dad, but you can do it that way. I did it with my daughter, carried her next to my skin, inside of a shirt, inside of a sling, so no one could actually see that she was skin to skin. And we walked around with total freedom, and she would actually breastfeed walking down the street. So it gives you a lot more freedom than you would have otherwise. All right, so the skin to skin, these are the topics we're gonna cover. Excuse me for a couple of the cardiorespiratory is not strictly spelled with a K, but we took a little license with that. All right, so survival is the biggest and best thing out of this. When I was in the first class of World Health Organization kangaroo care trainers, and one of the things they asked us to do was to be willing to go to other countries and set up kangaroo care in places in third world countries where They don't have great mortality statistics for babies. One of the best things you can do is hold your baby, little ones like that, skin to skin. It actually decreases the mortality rate dramatically. Kinder, gentle environment. This is how this kind of behavior came to the U.S. There was a backlash from the institutionalized hospitalization style of birth. This became quite popular when people recognized that birth doesn't necessarily have to be a medical event. And in fact, it's a good thing to do when birth has been a medical event, because it's a good way to bring it back to being something natural and normal. It can really soothe the mother's anxiety, give her something to work with as far as her mothering. Easier adjustment to life. They learn how to behave outside the womb a whole lot faster and easier. They learn how to breastfeed. Helps bonding. It helps the mother produce the types of hormones that set up low anxiety, high hormone setting for her. And it prevents too much stimulation. This is a key thing, and we're seeing a lot more about this in the literature. Immunity. So similar or fewer infections in preterms. What that means is that preterm infants had similar infection rates or fewer infections than the term babies when they were held in skin to skin. And there are so many reasons for that. Okay. So, number one, it decreases transepidermal water loss, which enhances your stratum corneum integrity. Yeah, I have to read that today because I've been up all night. Normally I can say it without reading it, okay? So the limbic stimulation that results in decreased cortisol levels, that is decreased stress levels for the baby, okay? That helps eliminate fetal circulation, which promotes enhanced circulation to hands and feet. So you'll actually see, we used to think it was normal for newborns to have purple hands and feet for the first couple of days. And now we know that it's only normal if the care they're getting is in the plastic box. If they are held skin to skin, their circulation dramatically improves much sooner. So what we're looking at now is what was normal when we were treating moms with all kinds of drugs and separating them from their babies is not actually what's physiologically normal. So it's kind of exciting to see us going back to the things we can do to enhance baby's health. The movement and touch against mom's skin actually produces improved immune function because of keratinocytes. Okay. And then the warmth stimulates cytokine production. We see here it says 45 minutes of KC at birth. That's the minimum, and they've now, most places that are baby friendly ask that you do a minimum of 60 minutes and that you do KC through the first feeding. Nutrition, they feed better, they spit up less, even babies who are formula fed. I mentioned that midwife that did it. We had a baby in the NICU who was failure to thrive. Mother was not visiting. The baby wasn't getting the love that he needed. The midwife who had delivered him actually came in and did skin to skin care. He stopped spitting up, he started gaining weight, and he resolved his failure to thrive simply from skin to skin contact. Cool? They have a better blood sugar even if you don't feed them. Better weight gain because they're not using all their calories to keep themselves warm. They're also not using all their calories in stress situations, in anxiety, in crying. They're much calmer. And then moms produce more breast milk, which is always a good thing. It's not just production. Moms who do skin-to-skin contact actually say they're more satisfied with their breastfeeding experiences. They report they've had fewer problems, and we know more than anecdotally, because those are obviously anecdotes, the research that I did for my master's was showing that you can make a big difference by keeping the children skin to skin that they actually get to the breast sooner, they get a deeper latch, and again, you get more breast milk as well. Okay. Interestingly, there's good research that mom actually digests her food differently. Not baby, but mom. Okay. All right. Thermoregulation is probably one of the things that most people are familiar with about skin to skin. One of the tricks to this is always covering the infant's back. Okay. When you cover their back, you seal in the adult's heat, and so you don't lose by radiation. Okay. I want to go back just 1 second and talk about, I forgot to mention, moms are more satisfied with breastfeeding. This includes even adoptive moms. Adoptive moms actually produce more breast milk. Well, did y'all know that you can breastfeed as adoptive moms? That's pretty cool. Okay. All right. The other thing is that it enhances oxytocin and prolactin levels for mom. It's one of the reasons she produces more milk, but it also is the reason I talked about before, mom's anxiety is decreased. So you end up with a calmer mom, and actually moms tend to be more interactive then as well. Baby has a more stable temp. They don't lose heat right after birth, which is a huge problem. The stopping them from shivering is a really interesting thing. You know, I hear all the time, oh, you're shivering because of your hormones. Well, you're shivering because the hormones aren't in the right balance. When you put a baby on a mom, her breasts sense the baby within 10 minutes of being there, and she can actually increase or decrease her temperature to meet the baby's needs. You can independently heat and cool twins on these suckers, which is pretty cool. The research was done locally, and it shows that we actually have a dual thermostat that men don't have. May prevent or decrease maternal depression. There's some pretty good research out here now that says, yep, it does. And it also works really well on maternal anxiety. Wearing baby is an exercise for mom. Okay, that's kind of stretching it a little bit, but if you carry your baby around when they're 6 months old, trust me, you'll feel some exercise from that. Okay. There are some other kinds of benefits. Babies with anomalies tend to do better in most cases. The moms feel like they're doing something for the baby. It enhances their sense of mothering, and it can make the baby's stress level less, so that they get better circulation, lower cortisol levels, and they just do better overall. Okay. And as you see, that one's kind of a unique family dynamic there. We got doing triplets in the NICU. So it works with all kinds of situations. So state or sleep-wake state, babies spend much more time in non-REM sleep, about 4 times as much when they do skin-to-skin care as opposed to wrapped up in the plastic box. Non-REM sleep is more like the womb, so people who benefit from this the most might be preemies who need that extra time in the womb and haven't gotten it. Okay. SIDS risk is inversely correlated with the amount of quiet sleep. And we now know that skin-to-skin contact, especially in the first few days, actually enhances the development of the sleep center in the infant, and we think that's one of the reasons that it influences their SIDS risk. Organizational brain growth is enhanced. There are some essential forms of learning and memory building that are actually enhanced by this. And holding your baby, they've done some really cool brain scans that just came out a few weeks ago that show that holding the baby lights up the entire brain. Every area of the brain lights up, and that's one of the ways that actually blocks pain, is it just overwhelms the brain with positive stimuli. It's pretty cool. That, because it does that, then it blocks noxious stimuli. Lowest oxygen consumption state, and a time of tissue growth and repair. So all those things occur more often and for longer periods of time. Growth hormone is also produced more as well, so the babies grow better. Crying, well, it's not a good thing. We used to think it was. We drugged up the moms, And so when the babies came out, we thought it was a great thing the babies cried because it meant they were breathing. But that's not really physiologically normal. It is normal for babies to come up the chest, find their mother, snuggle in, and be quiet for a while. The cortisol levels are decreased. That leads to cessation of fetal circulation, which is important for enhanced circulation. It closes off certain holes, the foramina vale for one, the ductus for another. So it actually contributes to better circulation overall. And we wonder now if babies who spend a lot of time crying, that's why they don't have a patent ductus or why they have a foramina vale that stays open, which we know can lead to all kinds of bad problems. Persistent foramina vale can lead to strokes in adults, and it's been shown to be an issue with migraines in about 40% of people. Healthy newborns cry when there's something wrong. They don't cry when they're happy. So leaving the baby skin to skin gives them what they need. They have proximity to their feeding source. They listen to mom's heartbeat, which they're used to. They smell their mother, and they learn to know her scent within about 3 days. So they're comfortable, they know it's their own habitat, and all of their physiologic processes are optimized. So this is the perfect place for them to be. It significantly increases intrathoracic pressure. Interestingly, the implication for parental emotions, if you have a baby who is crying a lot, you're more likely to have a parent that doesn't handle it as well. This can have huge implications for people who have less in the way of coping mechanisms, specifically babies whose mothers are opioid dependent. They can come out opioid dependent as well. The children produce their own endogenous opioids, which is great, which means you're going to have less of a reaction to the withdrawal, and you're going to have a baby that's calmer for the mother. So that's a win-win everywhere. Interestingly, babies cry less at a year of age if KC is done often in the neonatal period. So we think there are actually implications for putting all these babies in the nursery all these years and leaving them there that may be negatively impacting toddler behavior. And I will tell you, one of the things I used to hear all the time is, your child never cries. And I'd say, there's nothing wrong. You don't cry when there's nothing wrong. Typically, babies don't cry when they're hungry, they look for their food source. So if you wrap our kids up and put them in a plastic box, they can't get to their food source, they can't smell it, they can't hear their heartbeat, and that is very stressful for them. Cardiorespiratory, so more regular breathing without pauses. What this means to nurses is fewer episodes of apnea. So this becomes really important for our preemie babies or our babies with respiratory issues. They keep their oxygen level up better, and that's just all good for their brains. One of the reasons this happens is that there's increased parasympathetic control. That's something that is missing in preemies. We start out with a sympathetic dominance, and over time in the womb, ideally, that parasympathetic comes up and there's a much better balance and interplay, and that doesn't tend to occur as well when the baby is born too early. We can simulate the womb, if you will, and increase parasympathetic control of the heart rate. So you get a more stable heart rate, okay? Fewer problems with bradycardia in preemies, and better energy use and a lower metabolic rate, which means they're using less oxygen. So if oxygen stress is a problem to begin with, we can optimize their levels. Involvement, well, it enhances mothering behaviors. Parents learn a lot easier how to deal with babies. They learn what the baby needs. They learn what the baby's signals and cues are, and that makes for, anytime you have better communication, you have a better relationship. And we've heard that a lot, haven't we? How toddlers just don't communicate well. How many parents have learned to use sign language and taught their babies sign language, and they feel like that's a better relationship with less crying? Getting the skin-to-skin care early, the mom and or the dad, or whoever it is, develops a close relationship where they learn the baby's signals much better. Interestingly, from that, parents report decreased anxiety over infant appearance. They're not as worried about how their baby looks or things that might be wrong. They have more optimism about infant outcomes, especially when there's an anomaly. Okay? And then it's been shown to assist with grief resolution. Neurobehavior. This is one of my fun things because we're seeing so much new research about this. There's a multi-continent study going on right now talking about non-separation of infants and mothers. That means from almost any gestational age. I've seen Niels Bergman is the neonatologist that's doing this study, and he's done some amazing work. He's looking at taking babies as young as 26, 28 weeks and leaving them with the mother and showing that they're doing better than they are in the incubator, than they are on the vent. I watched, when I went to his conference a year and a half ago, I watched videos of 28-weekers latching onto the breast, which we all know isn't possible, right? We're taught that 28-weekers can't do that they don't have those behaviors. And this was a 28-weeker who shouldn't have been able to do that and spontaneously latched to the breast and fed, and it was amazing to see. Oh, the arrow. So KC benefits increase. What this means is that it's dose dependent. Doing it once at birth is really great, but the more you do it, the more benefits you get from it, and the more benefits the baby gets from it. Speeds up brain and nerve development. I already mentioned how it actually lights up the entire brain. Okay? You get a calmer toddler. You get a baby that spends more time in the quiet alert state, and that's their learning state. So less freak out and more learning. The Carey temperament scale at 6 months, you get improved scores on that. Higher mental control scores at 6 and 12 months. So we think this actually influences executive function, which is huge at that age. Okay? Enhanced vagal tone, better control of their bowels, maturation of their state behavior. And then this is doing it, when we say more is better, a minimum of an hour a day for at least 4 to 5 days per week during the first month of life. So what have you got to do the first month of life? But sit and hold your baby anyway. And then, I always like to finish with a laugh. Okay. Any questions?
There was a particular example that I liked in your class, like towards the beginning, about the dyad relationship between mom and baby. And it was like when you explained how like putting the baby on top of mom like immediately after birth, like because you mentioned the crawling up to the neck, but you know how you said that like the baby like crawls up and essentially like pushes that uterus down. Like could you explain that, because I really enjoyed that
Sure.
example.
So physiologically we're mammals. The dyad relationship that Mel's talking about is mom saves baby and baby saves mom. As the child is born, the mom typically will be in somewhat of a reclining position or squatting, tends to lie back afterwards. The baby's still connected, and the child is here because of the length of the cord. As the baby crawls up and does the kicking and getting, because babies do crawl at birth, okay, that kicking stimulates a change in the shape of the uterus, which tells the placenta to drop off. That lengthens the cord and gives the baby more room to come up. The baby then crawls up because breast milk smells like amniotic fluid. It's home to the baby. Plus, they have a biologic imperative to suck. If you had to double your weight in 4 months, you'd have to be pretty motivated to eat. And one of the ways God did that was to give us a really strong motivation to suck. So the baby comes up, and there's a period where the baby will knead. There are 9 actual steps involved in getting to the breast and getting latched. And one of them is the baby will spend some time kneading the breast. Kneading the breast tissue releases oxytocin, The kicking they're doing stimulates the uterus as well, and those things actually clamp the uterus down, cause oxytocin, which closes off those blood vessels that were attached to the placenta and prevents the mom from hemorrhaging to death. So mom gives baby warmth, security, safety, and nourishment, and the baby saves the mom from bleeding to death. It's the coolest relationship. Okay, I love it. Sorry. It's nifty stuff. Mhm.
If the preemies are the ones that need this so much, why are they placed in a box on the other side of the room or in the neonatal care?
Isn't that awful? So we're doing that less, okay? Actually, a lot of kangaroo care started with preemies in Brazil like 40-ish years ago. They ran out of incubators, and so they told the moms, keep the babies warm any way you can. So they did. They stuck them next to their bodies, and they started noticing that the kids in the incubators weren't doing as well as the kids with their mothers. So that's how kangaroo care got its start. We in the U.S. are very technology dependent, but we also believe that technology saves us. And so it's hard to fight that kind of thing, but there's never, ever, ever in the history of man been any kind of randomized controlled trial that said warmer care or incubator care is superior to mom, ever. The study's never been done. We made the assumption, and we've never studied that incubators are a good idea. So you're right, why do we do it? And the question is because someone thought it was a good idea. So it's actually never been researched. Any more questions?
But I have a question.
Yeah, I went to the very end. That was like a
This
long
is,
pause.
I know,
That was
because
a long pause.
you know how much I hate OB. All right, so this is just like an
Okay, no pressure
observation.
at all.
This is just like an observation, though. So, the one thing you said, like, really kind of stuck with me when you were saying about how the mom and the baby weren't bonding or something along those lines, and so the nurse did the skin to skin. Doesn't that kind of inhibit the bonding between mom and baby if other people are doing the skin to skin?
Possibly, if that were the case, but the case was not that she wasn't bonding, is that she had abandoned the child. So she
But
wasn't
then wouldn't
there.
that cause the baby to bond with that nurse?
No, I mean, not in the way that you're thinking. It's not like, gosh, it's not like the little book, Are You My Mother? So that's not the way it works. The bonding is forming a relationship, but I mean, you can form a relationship of different sorts with different people. Okay? Grandparents can do it, dads can do it, siblings can do it. And the baby does recognize differences. There are biologic differences, for one thing. Does that answer your question?
Yeah.
In this case, it saved the baby's life. We know they look at kids growing up in orphanages in places like Russia where there is a high, or rather a low ratio of kids to staff, and they're not getting the contact of any kind, much less skin to skin. And we see really delayed neurodevelopment in these kids, really delayed physical growth, and sometimes it's permanent. It's not something they can overcome. Cognitive issues are a problem.
Okay, any other questions? All right, great.